Okay, so we'll officially get started. So first, just a little bit of background on Nuha. She is 24 weeks pregnant. She has two sons, ages 6 and 4. She sees Dr. Kenney because she had a high-risk pregnancy her first time around, had some complications, and had to deliver her youngest son early via emergency C-section. So she is seeing Dr. Kenney, who is a high-risk pregnancy specialist here at Bryan. He also delivered one of Nuha's other children, so they have a very close relationship, and she is currently seeing him for this pregnancy as well. So if you remember, a few weeks ago, we had a media story with Dr. Kenney after the CDC issued some urgent guidance for pregnant patients to get vaccinated to protect themselves, their family, and their unborn children as well. And Nuha saw that story, saw it with Dr. Kenney, and it convinced her and pushed her to get vaccinated. So she had her first dose last Friday. So we thought we'd have a quick follow-up to show and have Nuha talk about her story and prove that these stories can have an impact on people in our community and help them make those choices. So first, Nuha, thank you very much for joining us. To start it off with you, if you could just kind of talk about what went into your decision to get vaccinated and just take us through that whole process, if you would.
So I am 24 weeks pregnant. I am high risk pregnancy due to the complications with my youngest son, Rowan. And also because Rowan was like in the NICU for like a week or almost 2 weeks. And then he came home for only a day and then was readmitted to the pediatric floor. So, and with his health, it just made me nervous. And then now we just found out that he has autism. So he is very he's a vulnerable adult, a child. And then my parents, they're older, they're almost 70. So I was like, I think I really want to get it, but I'm nervous because I'm pregnant and I don't know if I'm able to get it. And then I saw Dr. Kenney on the news and I was like, okay, well, clearly he knows what he's talking about. He's like the best of the best. So yeah, that's why I decided to get it from that. Yeah.
Great. And can you just kind of take us through, I mentioned that you had your first dose on Friday. How did you feel? Any issues?
Fine. No, I felt completely fine. I just was tired. I just had pregnancy symptoms, but that's like normal in pregnancies.
Great. Well, Dr. Kenney, let's bring in you now. Obviously, the story we did a few weeks ago had an immediate impact with Nuha. Can you just kind of talk about how important it is for pregnant women to get the vaccine and anything you'd like to say about Nuha's case specifically and why it was important for her to get vaccinated?
Well, I think it's just an example that every woman who's pregnant should get vaccinated. It was such a joy to read a message that she said, "Hey, I saw this and I got it," and that just overwhelmed me. That it was like, thank you, because earlier 2 weeks ago, we're making a decision: do we deliver this 24-week baby right at the edge of viability in order to try to save the baby and the mom? Obviously, the mom dies of COVID, the baby's not going to make it. How long can we, keep the baby in there when we can barely oxygenate the mom to keep the mom alive? When we're treating the average COVID patient, we kind of let the oxygen level drop down, but babies don't tolerate that as well because they can only suck oxygen from mom. And so it's just a very delicate balance. And, it just part of and I almost felt bad as, my patient that I was like, we hadn't discussed that, or maybe I didn't make a big deal because, half the time I have a 20-minute conversation with a patient. They're like, Kenney, you're crazy. You know what you're talking about. But it's just so, frustrating or hurtful because that's like they're not believing me. But we see the patients that everyone says afterwards, well, gosh, if I would have known about that, I would have done it differently. But it was very refreshing that she did get the vaccine, get the other one coming up here, and it is really that's one less patient we have to worry about.
Great. Well, thank you very much. If any media has any questions right now, go ahead. Feel free to unmute yourself and ask the question or submit it via the chat. We can have either Nuha or Dr. Kenney answer those questions.
Hi, Nuha. This is Camry Silv with 1011. I want to say, first of all, thanks for sharing this story with us. And then I also wanted to add, have you maybe had some other conversations with some other pregnant women about their hesitancies? And then have you kind of relayed this message to them saying, hey guys, like I got it, I was okay. Have you had this conversation among other pregnant women at all?
I don't know many pregnant women right now, but I do like advocate for the vaccine. I mean, obviously, like people are gonna have their opinions on it or their feel about it, but whenever I see somebody talking about the vaccine and how, oh, well, I heard this and that, well, it's like, would you rather hear it from, like, I always ask them, like, do you trust somebody off the street or do you trust a doctor? Like, it's two different, like, perspectives. Like, I rather trust a doctor who actually went to like school to get their degrees, and then instead of somebody from just the street just giving me their opinion just because that's their opinion. Rather, I mean, like a doctor is going to know the facts, not like they're not going to put you in a situation where you are going to be like at risk for it or to receive or to get the COVID or anything. Like, I don't know. I just saw Dr. Kenney and I just on the news and I was just like, this is my sign. I need to go get it, because if I don't do this, like I may not have placenta previa this pregnancy, but I mean, anything could happen within a split second. So I was just trying to be precautious this time around with this baby. And I trust everything he says. Like, he's a wonderful doctor. And obviously if my OBGYN is already saying Dr. Kenney's the best of the best for high risk, I'm going to trust anything he says.
Okay, we had a couple questions come in via the chat for Dr. Kenney, so I'll read those if you don't mind. Dr. Kenney, earlier, our last press briefing, you mentioned the dangers of pregnant women getting COVID. Can you repeat that again and just let the media know what are some of the dangers if a pregnant woman gets COVID-19?
So pregnant women have about a 3 times more likelihood to need to be admitted to the ICU, 3 times more likely to need ventilator support, and a 1.7 more likelihood to die than their age-matched counterpart. When you look at, these are usually younger women or younger than the average person in the ICU. That's an astonishing number. And so we have had a maternal mortality. I have to make the decision to where we basically delivered her on admission because she was sick and she was far enough away. As a high-risk OB doctor, I have to deliver 24-week babies, and I'm always thankful that they do so well in the NICU. And again, I have to do that to have the mom survive sometimes and for the baby's sake. We've had a mom that had to stay in the ventilator for a month, and then she has to go to Madonna to rehab because after you've been paralyzed for a month. So we really have had some devastating cases in pregnancy. And I mean, our NICU was closed last week, and a lot of them are just from COVID babies babies didn't have COVID, but mom had COVID. So we had to deliver so many of them early that they're filling up our NICU. And so that we could get mom's care taken care of.
Great. Kind of a similar question to follow up from Matt. You mentioned the last briefing, and you just mentioned as well that you had a pregnant patient pass away because of COVID-19. Can you just talk about that? Not that specific situation, but how prevalent has that been? How many have you seen in the hospital with COVID, and how many have been seriously ill and passed away? How prevalent has that been?
Well, we've only had the one mortality. We had one that the doctors were, the critical care people, we were well over, getting close to, about 20 to 30% chance for survival when we decided to deliver her. And thank goodness she's improved since we delivered her, and she'll probably be able to go home. We don't want anyone to die, and we don't want babies to die either. And early in my career, people said, who do you choose, the baby or the mom? I'm like, well, baby's not going to make it without mom. It's a delicate balance. But I also can't have mom, if she can't oxygenate for herself, she's not going to oxygenate for the baby. So we have to do both of them. And sometimes the NICU is a better place for the baby if mom because, and that's what's so frustrating for the pulmonologists, because they're like, normally if someone just had a pneumonia, we could put them on a ventilator, they'd get better 3 days later, get them off the ventilator, and it wouldn't be a big issue. But when people get a ventilator on COVID, they're on that ventilator for a month. And once you get on a ventilator, it's 50 to 85% chance that you're going to die. And so we do everything we can do to not put them on a ventilator.
All right, thank you, Dr. Kenney. Here's a question for Nuha. Nuha, can you explain some of the reasons that you may have been nervous about getting the vaccine at first, or was there any initial hesitancy? And just maybe discuss the timing and why you decided to wait.
So the only reason why I was nervous was because like I'm fully vaccinated. I've always been vaccinated, even as a child. Like I'm pro vaccinations, but I was just nervous because I am pregnant. I am high risk. I have, I'm not like a regular, healthy pregnancies where you have no issues with anything. But I think I was just nervous because I didn't know how it would affect me. I didn't know if I was gonna get sick or what, or I don't know. And plus I've been avoiding going out. I just do usually like grocery pickups and all that. So I didn't feel like I really needed to get it. And I was just like, I really wish I kind of got the vaccine before I got pregnant. But then again, I'm happy that I saw the article and got it. And now I'm on the road to being fully vaccinated.
All right, thank you. Dr. Kenney, a couple more for you. From Alyssa, she asks, there's been some pregnant women and their babies that have had side effects or adverse reactions from the vaccine, but can you discuss how likely it is to have a bad side effect versus contracting COVID? What are the pros and cons there? What have you seen, vaccinated versus unvaccinated?
There, to be clear, there's no association with infertility with the vaccine. There's no birth defects. There's no risk of miscarriage. So really the only known, other than, the really bizarre, like getting hit by a semi from the vaccine, there's no real risk as far as that goes that we know of. So I haven't had to admit somebody, I haven't had to treat anybody. Nausea, vomiting, low grade temperature, yes, those things can happen. But we have not had any serious side effects of any of the vaccines in Lincoln. Whereas again, we definitely have had problems with COVID. And truly, most people can get through COVID without a problem, but there are those few people that won't, primarily African-American, Hispanic, obese people are major risk factors, diabetics. And that's what's frustrating, because I'll look at somebody, I'm like, and I'm overweight, so I'm not picking on people because, I had to say it myself, my risk factors, I'm 55, I'm overweight. I don't want to see my colleagues, the pulmonologists, if I got COVID, because I'm someone that is at risk not to do well.
Okay. Nuha, another question came in for you. Would you have got vaccinated earlier had you not been pregnant? Was that one of the issues that was kind of not holding you back, but making you kind of a little cautious? Or you kind of addressed this earlier, but if you could repeat that.
Yes, I would have gotten the vaccine before I got pregnant. But when I got pregnant, I would think that's what the time was like. The vaccine was being like brought out, and then they only had Johnson and I think they only had that, not Pfizer. And I think Pfizer was being made, and I wanted Pfizer instead of the Johnson and Johnson vaccine. But then I got pregnant, and I was just like, I don't know if this is like going to be more stress on the baby or what. And then I was doing my own research. My parents they're fully vaccinated. They got the finishing vaccine of it, and they were the booster, and they were like, you should get it. And I was like, I don't know yet. Like, I don't know if my doctor wants me to do that. I got to ask next time I see them. And then I saw Dr. Kenney on the news, and I was like, yep, let's go do it. Let's set up the appointment. Let's go CVS and get it done. Instead of just, sitting around waiting. I'm not gonna, I see Dr. Kenney on the news talking about it, saying, go get it. I'm going to go get it without even, I let them know before I did it, but I just got it done.
Great. That was actually another follow-up question. If you're comfortable sharing, where did you get your dose, and did you get Pfizer or Moderna, or if you're comfortable sharing that was a question.
Yeah,
that just popped.
I got Pfizer at CVS. It was really quick. They just, put the shot in your arm and you have to wait, I think 10, 15 minutes and then you go. But just see how you react to it just in case. And then I was just fine. And then when I got home, I'm pregnant, so I was just eating a bunch of snacks. But I got the Pfizer because my family were all telling me like, hey, we got the Pfizer. We had no symptoms from it. My fiance my husband got the Johnson and Johnson, and then he ended up getting sick from it. So he's actually trying to see if he can go get the Pfizer instead, because I was like, what? That's why I was like hesitant at first, because he got the Johnson Johnson beginning. That's why I was like, I don't know if I want that one just yet. But I'm
Sure.
happy I got it.
Great. Based on your experience, would you recommend to your friends, to your fellow pregnant women, to get the vaccine based upon how you felt?
Yeah, I felt fine. It's really a simple thing. It's literally putting a shot in your arm. You wait 10 to 15 minutes. They check to see if you like how you're doing, and then they send you on your way, and you can proceed the day like normal. And I felt great. Like I said, I went home, I ate snacks, I was just relaxing. I still wear the face mask until I get my second dosage. I think it's in 2 weeks, and then after that, I think you get another one or a booster, but that's 6 months later, and then you're just fine. But I feel great. I mean, the baby's kicking a lot, so I recommend it. I think everybody should get it. Even if you're not pregnant, I think you should get it.
All right. Dr. Kenney, same for you. Obviously you would recommend it. Can you just kind of give a sales pitch for those out there that may be thinking about it or on the fence, and why it's a good idea?
Well, obviously, so many people you can still get COVID when you're vaccinated. But when we talk to people about whether or not to give them antibodies to help them get over it faster, when they said, oh, I've already been vaccinated and I've completed my series, I'm like, oh, your chance of getting severe disease is so much lower. We're not going to worry as much about you. And so far, most people have just had the sniffles, almost like a cold, because they've already been vaccinated. Their body's going to mount that immune response for them. Another woman on one of my Facebook things is a pediatric psychiatrist, and she was worried about it because she has a 7-month-old at home, and her 2-year-old has it, her husband has it, but she's already been vaccinated. And I said, your baby has your antibodies because you've been vaccinated, so your umbilical cord already gave your baby the antibodies that it needs to help fight this off, and the chance of you getting a severe infection is low. So it's all good that she's had it. Again, I today got my flu shot and my booster shot, and again, why do we do this? I have 9 kids. I need to be around. There's chance of me getting severe disease is low, but other than the people want to post and say, well, I didn't get it. I mean, how much benefit is that to you? If I do get it, I will be exposed. I'll be shedding the virus for a shorter period of time. I won't be exposing my patients. I won't be missing work as long. And it's a good idea for everybody, like she said.
Okay, great. Any other last questions for Nuha or Dr. Kenney?
There was one question about can pregnant women get the antibodies, and yes. So the prophylactic antibodies with the monoclonal antibodies are available to pregnant women. We are giving them both we're a little short on them right now, so we're not doing as much for prophylaxis as we are for treatment. But, and again, I would definitely give it to somebody if they had risk factors, or offer it. Again, the one lady that got very sick, she refused it. And it's like, why are you refusing this? It's healthy, it's good. We use antibodies all the time. There's a shot called Rogam, which is given to Rh negative mothers. It's an antibody, basically. It's a little different, but it's very similar. And most people tolerate the antibodies well.